Good evening, everyone. Thank you, everybody, for coming. I really appreciate you all being here in this weather. I know it's ugly outside, but we can't do this without our citizens. We really appreciate everyone and our staff as well for being here. All right, so today is Wednesday, April 25th, 2018. It is 5:31, and I'd like to call the meeting to order, the Central Health Board of Managers. Let me go ahead and read the agenda items. First, we'll have citizen communications, and then agenda item 1 will go next. Agenda item 2 will follow. Agenda item 3, and then agenda item 4, and then 5, and the consent agendas, and then agenda item number 9. And I'll read them again as we go through them. So, and 6, 7, and 8 will not be discussed, and they are read items. Is that correct?
Just read out the items,
Okay.
6, 7, and 8 that aren't going to be discussed.
Okay.
Just for the record.
All right. So, agenda item 6 is discuss and take appropriate action on the 11:15. Do I need to do it now or later?
Yeah, you can do it now.
11:15 Medicaid waiver delivery system reform incentive payment program, community care collaborative, including healthcare delivery arrangements and other interrelated community partnerships. 7, discuss and take appropriate action on the update regarding Sendero Health Plans, Inc., including the effect of federal legislation and regulatory actions. 8, discuss and take appropriate action on Central Health owned properties, including the downtown campus and adjacent properties. With that, I'd like to invite our citizens up. Catherine Kina with Creators of Austin and One Voice, Texas. Thank you for coming.
Thanks, Jim. I'm Jo Catherine Quinn. I'm the Executive Director at Caritas of Austin, and I'm also the Chair of One Voice Central Texas this year. One Voice Central Texas is a coalition of executive leaders of more than 100 nonprofit health and human services organizations. We are working to make sure that everyone can contribute to our community and thrive. One Voice represents the integrated network of human services that connects everyone of all ages and circumstances to social resources, opportunities, and support so that each person can reach their highest potential. And my purpose for being here today is really just to be sure that you know who we are and make a connection between our common work. When we want to thank Central Health for your ongoing support of health and human services in our community. Our organization, Caritas of Austin, believes that every person deserves a stable place to call home, and our mission is to end homelessness in Greater Austin. We contribute to the overall well-being of our community by providing supportive housing for people experiencing long-term homelessness with a 97% success rate. One Voice Central Texas hopes that you will continue to recognize the value of building well-being and continue to invest in health and human services so that all people can contribute to our community. Thank you for the opportunity to speak to you tonight, and thank you for your public service.
Thank you.
Thank you for coming.
Thank you.
Our next speaker will be Walter Moreau, Foundation Communications. Foundation Communities.
Yeah.
Walter, thank you.
Yeah, I wanted to come and say thank you so much for investing in our health insurance enrollment program. Elizabeth's going to come up in a minute and share the results. This year was a challenging year. We didn't know a year from ago that we were going to still be able to offer health insurance enrollment for folks. And we only had 6 weeks to do it this year. I'm just really grateful because 6 years ago when we had this idea that Obamacare was coming, it was going to be complicated. People are going to need that one-on-one help to understand their options. And I appreciate that Central Health and this board and Larry and team, said, yeah, this needs to happen because people don't want to also make a mistake. They want to get coverage that's going to work for them. I want to quickly just do a shout out to Kit Abney Spouse, to Michelle Tijerina, to Becky Huerta. The staff have been really, really great to help us get the word to people. That's all I've got, and I'm going to turn it over to Elizabeth.
Thank you, Mr. Morrow. Our next speaker will be Elizabeth Colvin for Foundation Communities. Thank you, Ms. Colvin.
Thank you. As Walter mentioned, this open enrollment season was quite challenging. Nationally, the numbers were down 4%. In Texas, they were down 8%. But thanks to your support and the support of the Austin community, we had a 22% increase in marketplace enrollments. We had a phenomenal season. We actually beat our 2017 numbers in half the time. And it's really because of our partnership and the support we get from Central Health. As you can see from the report distributed, more than 1,800 of the individuals we enrolled were uninsured at the time we enrolled them. So those are people who now have health insurance thanks to the support you've given our program. More than 3,000 of the individuals we enrolled identify as a person of color. And we're really grateful for all the partnerships we have in the community who refer people to us, who really see us as the experts in marketplace coverage. And we are honored to work closely with Seton Oncology, Texas Oncology, David Powell Clinic, Community Care, numerous Aid Services of Austin, numerous organizations in town who work with people with very complex medical needs. And we are their go-to resource for guidance on marketplace health coverage. It's an honor to serve them, and we're proud to really be the experts in this area. Because of your support, and really what your return on investment is for your support in your program, is that we claimed over $40 million in federal tax credits and subsidies that make health insurance affordable for people in Austin. And that's $40 million that people will benefit from in 2018 as they keep, use, and maintain their health insurance. We are open all year. For us, open enrollment is just part of what we do. In the first quarter, January, February, and March of 2018, after open enrollment had closed, we had about 1,500 fulfilled appointments, people who came to our office, met with us to either enroll for special enrollment, but mainly it was to help navigate their insurance. Issues with payment, questions about connecting with a specialist, just trying to understand and learn and how to use their health insurance. And we do that every day. We're open, serving people with appointments, and we're glad to do that. So thank you for your support. Thank you for allowing us to do the work we do. And we'll now have Mitchell Gibbs come share his experience.
Thank you. All right, our next speaker is Mitchell Gibbs for Foundation Communities.
Hello, thank you for having me. My name is Mitchell Gibbs, and I've been working in the social services nonprofit field for about 30 years, and I know some of you in this room. I'd like to share with you for a minute what it's like to be on the other side of the coin. My brother had been my dad's caregiver for a number of years, caregiver and companion. My dad died November the 29th. January the 10th, I'm in Round Rock. My phone rings at 5:30 in the morning, and my little brother says, I'm in Shannon Medical Center in San Angelo, Texas. They think I've had a heart attack. Can you come? And 4 hours later, I was at his bedside, holding his hand, listening to a doctor tell us that it wasn't good. We had at least congestive heart failure. We probably had had a heart attack. And San Angelo wasn't equipped nor prepared to deal with all the things that were going on with his medical condition, and they wanted to make a referral. Folks, I was scared out of my mind. The ink wasn't even dry on my dad's death certificate yet, and I was now planning the funeral for my little brother. And I didn't know where to turn or what to do, and I've been doing social services work, much of it in this community, for a long time. And we were very fortunate to walk through the door from our referral when we got discharged, got him to Round Rock. We got to Seton Heart Specialty. And they put us in front of a doctor, and that cardiologist said, I need for you to do three things. You need to stop dipping, you need to get your diet under control, and you need to get insurance. We'd missed the application window for the Affordable Care Act. We had been, for the past 10 days, I didn't have anything else to do while I'm sitting in the hospital. I've been on the phone, I've been calling private insurance, I've been talking to the folks at the Affordable Care Act, we've been on healthcare.gov, been working with social workers at the hospital in San Angelo, and things did not look good. There wasn't a bright spot on the horizon for us. And the social worker at Heart Specialty handed me a flyer and said, here's something from Insure Central Texas and the Community Foundation folks, you need to call them. We did, made an appointment, walked in there. They had some amazing volunteers, but I got to tell you, Alessandra is a staff person, and this woman, she knew what she was doing. We weren't there to talk about why he didn't have health care, that he didn't previously agree with a politician telling him that he had to buy health insurance, and now we've got to come to a different party. We were there to figure out where we were today and what we needed to do to be here tomorrow. And she got on the phone, she got his proxy. In her office that day, she made phone calls to the folks at healthcare.gov. She didn't talk to the first person and take what they had to give. She elevated it each step of the way. And when we walked out of that office that afternoon, she said, you may have something coming for you in a couple of weeks. 3 days later, we had preliminary approval for health insurance through the Affordable Care Act. My time's up. I would tell you, Thursday last week, my brother had a quadruple bypass at Seton Medical Center. They did a mitral valve repair job on him while they were in there. I don't know what our future holds, but I know that I wouldn't be here today with you, and he wouldn't be at Seton in a recovery process if it had not been for Foundation Communities, Insure Central Texas, and your support of those programs and the work you do in this community. And I thank you, and my family thanks you.
Thank you.
Thank you, Mr. Gibbs. JP? Central Health?
Good evening. My name is JP Eichmiller. I'm the Director of Strategic Communications here at Central Health. And today is an exciting day for Central Health and a very exciting day for me because I am able to introduce you to Tracey Earhart, our new Senior Data Management Healthcare Analyst. Tracey comes to Central Health after 5 years experience at the Women's Health and Family Planning Association of Texas, often referred to WFPAT, I believe. She last served there as the Director of Research and Evaluation, and she oversaw the data collection for Texas's Title X network of, I believe, over 100 clinics. Her education includes a BA in psychology from the University of Michigan and a PhD from the University of Texas at Austin in psychology, in social and personality psychology. And what really excited me when we were being introduced and meeting her was her passion for merging qualitative and quantitative data, which is so important to what we're doing and what we're looking at going forward. Here at Central Health, she's already begun the process of being embedded with our joint technology team, data analysts at the CCC, as well as community care. And leading off of this work, she's really going to help us develop some new analysis and measurement tools going forward, many of which we hope you will all see very soon. So thank you for your time, and just wanted you to connect the name with the face.
Okay.
Welcome.
Yeah, have a few words to say. Can she say
Yeah,
anything?
sure, of course.
Wasn't planning on it, but I'm very excited to be here, and it's been a really good experience so far with really smart people and passionate people here. So thank you for having me.
Thank you.
Thank you. Mr. Franklin?
Good evening. Last week I was working in school, one of the middle schools. A young man the day before had been rather manic in his behavior, uncontrollable, bouncing around the room. Next day I saw him in the hallway. He was literally staring at the wall, possibly having some type of depressive process. I don't know what was going on with him. But we've been lacking those type of services, mental health issues, organic health issues, in Del Valley for quite some time. We've got a meeting next month, first meeting in the Hornsby Bend area on the 2nd, next Wednesday. I got an email. In fact, they asked me to put some people together for a panel of community activists, community input, et cetera, et cetera. It's the first meeting we've had in our neighborhood, and one of the individuals started asking questions right away. He doesn't want to be meeting just to be meeting again. We've met. This will be the first meeting in our community about our needs. Over the last year and a half since we started this process, we have met, actually last year, until the conversation we had in February, August of last year, where you said you were going to put some money into our neighborhoods to provide services. We haven't had a meeting since then in our community. We have had a meeting with some other board members. Again, we hear back from those board members immediately, though that were not well attended. My question to you as a board is, why do we continue to have to meet to get services that we're supposed to have? Do you have these kind of meetings continuously, over and over and over again, to ask what people need when other people's needs are being met already? The man said he's had his situation met. But Eastern Travis County, which has the highest rate of everything problematic with health, mental health issues, is still having to have more meetings. We ain't broke ground on anything, and supposedly we're going to get something, and over here on 812 we're going to get something, we're going to get something over here. Pop Warner football is finally coming to Del Valley, something that's going to be healthy for our children. Can we get some support for that? Can we get some support for this? Because at least I can say my kids can go out and play something with the obesity issue we have in our community, the asthma issues we have in our community, something to show that you care enough to do something about what's happening in our community rather than having another meeting. We didn't have a place to have the meeting. You didn't have a building to have the meeting. We had to have the meeting at a restaurant. I don't understand what you're doing. I don't understand if you understand what you're doing, or in this case, not doing. Hornsby Bend has 10,000 plus people in it. And we're traveling miles and miles, hours and hours to get to anything. And the Del Valley area is suffering. We had a meeting this morning again with ABLA and the city manager, talking about the fact that now, you don't have city services out there where people have been brought in. Nothing. I don't understand why you organizations, you city functions, you county functions, you central health functions don't understand that people are suffering. When are you going to do something for people who are suffering? That young man needed help, and there is no help. And I guarantee you, he was too poor to get to some help. I'll leave this for you there, Mike. You can take that if you like.
Thank you, Richard.
Thank you, Ms. Franklin.
Thank you.
Stephanie, your health.
It started raining right before the board meeting today, and I think it's because I have to share some bad news with you. Today is Leslie Nelson's last board meeting with us. She is leaving us. She's been poached by her old boss at HHSC. I think she's going to be tasked with some very important work with our state assisted living centers and state hospital campuses, if I'm correct. And I know that's really important work for the entire state of Texas. But I am really very sad, personally, to have Leslie leave us here at Central Health. And she has done a remarkable job, a lot of it very quietly in the background on women's health and making sure that we get these meetings and agendas done. So please join me in thanking Leslie for all of her work for this past year with us and wish her good luck in her future endeavors. Thank you, Leslie.
Thank you, Liz.
Thank you, Leslie. We will miss you, but this is good for you. Thank you. We'll miss you. All right. So now we're going to go to agenda item 1. Receive and discuss an update on future healthcare delivery locations and receive an update on healthcare services delivery expansion in Eastern Travis County. This should take about 40 minutes. Mr. Wallace and J.P. Eichelman and Mike Eason will start off.
Yes, ma'am.
Thank you. Thank you, members, for this opportunity to provide this update, and I'll tee it up and then I'll turn it over to Larry. But this speaks to the geography of health, and it's under our working objectives where we need to refine our healthcare delivery strategy is based on place and people, meaning take the care to where people are and where people are going to be. And specifically, it speaks to the strategy related to service locations and care delivery. Through analysis and stakeholder input, determine what the future service locations will be, the best site uses, and how best to utilize mobility, technology, and transportation solutions to deliver healthcare to people or to bring people to healthcare. Now, this is going to be an ongoing effort over the next several years, and you'll have periodic updates and resetting of milestones and objectives as we reach our objectives, and then we set our sights onto the next time period. But also be changing how we measure success. It's not just about building a building, but it's about improving healthcare outcomes. And we hope that you find this informative. Again, we're trying to line up some of the reports based on a specific strategic outcome that we're working towards. And you'll hear a lot in Larry's presentations about stakeholder involvement, and I think it speaks to what you heard in citizens communication. We do not want to design and do anything in a vacuum. And yes, we will continue to go back to the community with each key milestone and ask them, what sort of services do you anticipate being delivered? Is it just healthcare? Because we could line up an entire flight of resources and services and completely miss the mark. Even though the data says one thing, there is nothing that beats on-the-ground intelligence in a community to inform what it is that we do in any given location, not unlike the approach that was taken for the Southeast Health and Wellness Center. So with that, I'm pleased to introduce Larry and JP for this presentation.
Thank you. Members of the board, we're delighted to be able to provide this information to you. And don't be alarmed by the number of slides. I don't read slides. And about a third of this presentation are graphs and pictures. So I think it'll go pretty quickly. The purpose of our conversation with you tonight is to provide information on health services, delivery, expansion planning. And what you'll hear is an update on our current projects. We'll talk a bit about the options, slightly about capital requirement. You'll hear more about that through our finance committees. Educate, inform, and this is really to prepare you for community care, which will come next month, and provide some planning efforts that are underway with their organization. So our table of contents are listed there. I'm not going to read them. And we'll just move pretty swiftly. Some of this is for your reference. It's information that you can have and keep. It's part of just the education process. First of all, I'd like to talk about the Eastern Travis County Health and Wellness Collaboration. And that is really our meeting that we have with multiple agencies to come together monthly. We have over a dozen agencies that are meeting, and our purpose is really to address healthcare in the community and to do it in a collaborative way. When we began this effort a couple of years ago with just a few of us, the one thing we agreed on, we were not just going to meet to meet. We have enough meetings, but that there will be action that really come out of our efforts. And I'm really pleased when you look at the track record and you hear more about what's really before us. There is a lot, quite a bit of action that is underway. Okay. This is a list of our partners, and it's an extensive list, and it continues to grow. At our last meeting, we had ACC, Austin Community College. They joined, and we're delighted to have them. We think that they bring an element to our conversation that was missing. It's around workforce development, training, education, and they're focusing quite a bit with the Community First Project, Allen Graham, Mobile Loaves and Fish. But that's the list of our partners, and again, it started with 3, and now we have over a dozen. And what it speaks to is our ability to bring people to the table and have conversations and come up with solutions. These meetings are not central health meetings. I think that's why it's successful. These are meetings that include all the partners, and everybody has a chance to come and present their issues. And we convene, but the result speaks for itself. Okay. So JP is going to talk about the next two slides regarding changes in poverty and over the next 5 years.
Yes. Good evening again. So one of the primary goals when we developed our demographic report was to assist with facility planning, particularly in the underserved areas of eastern Travis County. I'm not here to go over the demographic report with you, but I just wanted you to know some important things and how it's feeding into Larry's work. So this slide you see, this is one of the models we developed to project how the populations, particularly those families in poverty, are projected to change over the next 5 years. If you look at this closely, and there aren't any icons as far as identifying neighborhoods here, but this shows the 217 census tracts. And what you can see by the size and the darkness of the circles is where there's going to be the largest increases. And not surprisingly, we see some familiar areas. We also see some new areas popping up that we know we need to focus on going forward. And so what we developed from that projection was essentially a map here highlighted 40 census tracts, 40 out of those 217. We believe these 40 census tracts will be home to 1/2 of all the families in poverty in Travis County. Again, when we looked at this, we saw some good, and we saw some areas that were troubling, concerned us. Runberg, Mentopolis, Dove Springs, we saw areas that we are serving, we have focused on. But areas to the north, such as Pflugerville, to the east, Del Valley, Hornsby Bend, County Park, we identified areas that we really were seeing significant numbers, the highest numbers in Travis County among those with families in poverty. And I also want to caveat this, is that this is not everything, this list. We don't want to ignore that other 50%, which is dispersed in other areas throughout the county, which is why later in this presentation you'll hear about some of the other areas such as Creedmoor, Jonestown, areas that have significant need. They just don't have the population and those concentration that these 40 census tracts do. And lastly, I just wanted to mention, this is, as Mike said, this is data, this is information, but what's been really exciting about this process is because of the collaborations and all the folks we've been working with, we've really been able to actuate this information. We've shared the data with partners. We've gone into other areas such as social determinants, transportation, housing, and we're bringing other people to the table that are allowing us to do things that we haven't been able to do before.
So this next slide really is a recap of the projects that are underway. To the left, you have a list of those projects, which include Del Valley, Austin Colony, Hornsby Bend, Creedmoor, Elroy, Rosewood, Zaragoza, Colony Park, and as JP mentioned, Jonestown. Even though that's not Eastern Crescent, Jonestown is still an area that we serve. And we are about to have some conversations in Pflugerville that will lead us in that direction. So if you just look at the map where these locations are, and you have maps of what JP just showed you, you can see that we are spot on responding to the needs that were identified in his previous map. Some estimated timelines on when you can expect to, as a board, have some requests coming your way. With the Creedmoor project, I expect that within the next 60 days, we will have a request, and that will likely be a modular or prefab facility. Elroy, that's the partnership with the Fire Department, the Emergency Services District, and the request there will be to support the expansion of that facility that is owned at the fire station. I expect you will, a similar timeline, probably around July. Austin Colony, we're going to have our first advisory committee meeting there within the next week or two. And we have a couple options that looks like are being presented to us. We'll learn more after we have our first meeting. Community First Village, that is really a funded project. Alan will raise his own dollars for it. But whatever approvals we need, we expect to come to you in August for that. Pflugerville ISD, again, we believe that in the July timeframe, we'll have a request for funding for a modular. Rosewood Zaragoza, as you know, that site is being repurposed, and there'll be a further detailed slide later in the presentation. And transportation initiatives, JP has really been doing a lot of work in that space. Would you like to give an update on what your projected timelines are?
Sure. We've got a few in the work. One actuated right now, which is the CCC's Ride Austin initiative. A second we're working on with Community Care to provide transport services to and from Southeast Health and Wellness Center. I'll caveat that with, depending on the timeline with our attorneys and risk managers, we hope to have that launched in June. So we would be providing a new direct service from residents in the Austin Colony, Hornsby Bend area, as well as Del Valley, the Elroy area, to and from appointments at Southeast Health and Wellness Center. And then there is a third transportation pilot that we're working with the county, Cap Metro, and Community Care on that. It's still in the nascent stages, but we are hoping to have that launched hopefully by the end of the fiscal year.
And on the right side of this chart are opportunities for fiscal year 19. What I provided to you earlier is what we expect to bring in fiscal year 18. And that includes the Colony Park Master Plan, that's the city development. Phase 2 for Travis County, they're building additional facility out adjacent to their current location. Potential for purchasing land in Del Valley. There'll be additional work in Manor as well as Pflugerville coming your way for next year. This slide, I'd ask Stephen, he's not here tonight, as we begin to talk about capital requirements for this work. And we're not going to get into much detail at all around those requirements. That'll come at a later time through our finance area. But we have been communicating with finance as they develop their budgets on our projects going forward so that it can be represented in the budgets that you'll see later. But this just basically shows if you're building a site, percentage that breaks down with hard construction costs versus furnishings and admin space. So all of that factors in. And Jason may have a little bit more on that for his presentation as he talks about advancements in their network going forward. Our service delivery strategies and criteria are listed there. I think probably for me the two most important is already been alluded to, the needs assessment, the data, and then the community input. So we need both of those for us to make the right decision. Data can say one thing, but we listen to the community, and we will continue to listen to the community. We think that's important. But the rest of those are listed. The other, I think, is funding. How are we going to pay for all of this? That will be our challenge as we recognize the needs. And lastly, it needs to be our covered population. Service delivery strategies and locations. Again, this is a list of opportunities, different partners and methods that can be used as we advance healthcare. So it lists the Travis County facilities, the fire departments. These are non-traditional partners in some cases. It's just kind of nice. We're getting outside of the box and finding other solutions. The City of Austin, the list is there. Another one that we will spend quite a bit of time on is schools and leveraging space in schools. Faith-based organizations, that's another opportunity. And of course, our co-location strategy. Mobile solutions. I don't know how many of you remember the big pink bus, but we located it, and and it is a big pink bus. And so, as you probably know, this was connected to a district project around mammography, and that project has concluded. And so this resource is available for repurpose, and we will be talking to you more about that. And I think Jason may mention it in his presentation for next month. Okay, I want to talk a bit about facilities, and basically there are multiple approaches, but just for to gain a perspective as we move forward and we talk about facilities. And again, you'll hear more from Jason when community care comes next month, and talk about their vision for the next 5 years as it relates to facilities. One way to talk about it is to have facilities in categories. And so what we're offering is what's called a level 1, level 2, and level 3 facility. A level 1 offers a full array of services. They're listed there. That's like the Southeast Health and Wellness Center, where it's full comprehensive, and you can get pretty much everything there. The other site that falls in that category is North Central. The information that will be important to you going forward is the capital required to fund these facilities, to build them, and then to maintain them. And so you have some baseline preliminary data that speaks to square footage, number of exam rooms, specialty procedure rooms, number of providers, support staff, and then most importantly, how many folks are you going to be able to serve. So this is an example of a level 1 health center. And why don't you move to the next? Okay, so there's a picture of a level 1, and that's the North Central Health Center. Okay.
Another one would be Southeast Health and Wellness.
Yeah, I mentioned that, right. So level 2, it doesn't have the full array, but it has a moderate array. So if you watch the language and it's bolded on your charts, you'll be able to tell the difference between the 1, 2, and 3. And so with this model, the services are not as comprehensive, but yet pretty robust. The square footage is smaller, exam rooms, staff, number of providers, and your capacity is less. Some examples of our level 2 facilities are Sandra Joy Anderson and East Austin Health Center. And this is a picture of a level 2 health center at South Austin. And level 3, which is the last category, these are the limited array of healthcare services. Generally, nurse practitioner, staffed, and limited scope of service. These are models that we're using in Del Valley right now at the Del Valley Employee Clinic. It would fall into this category. And it's also what we do in Manor now. So less exam rooms, less number of staff, and less cost, if you will. And that's a picture of a level 3. Okay. So basically, what I would advocate is what we call a hub and spoke model, where you have a level 1, which is more like a regional health center approach, like a Southeast Health and Wellness Center, and you have your level 2s and level 3s that are more into the neighborhood and communities, smaller sites. They feed into the level 1 regional health center. So we have 2 of those that fall into that category. Southeast is covered because Southeast Health and Wellness Center. We do have one that is central. We believe that the new health center in Colony Park will meet this requirement. And we're going to have to look at data and figure out what we do further north in the Pflugerville area. But this allows us to maximize on economies of scale, scope, and all that goes with it. And so just a graphic just to let you know what our thinking is going forward. Would like to talk a bit about what's happening in Southeast Travis County. That includes Del Valley, Austin Colony, Hornsby Bend, Creedmoor, and Elroy. First of all, this site is open. It opened a little while back. The county graciously gave us permission to use it. It is part-time. It will increase in number of days available as the county opens up their new building that they're working on now. And we believe it probably should be done maybe by the end of the year, I think, is what I was told. Del Valley, Travis County Health Center Development. Okay, this is the work that the county is doing out on FM 973. Phase 1, that's the one that I said is already under development for WIC services. Following that, there'll be a Phase 2, which will be 5,600 square feet with multiple floors. And again, that project is 2 years away. It has the co-location strategy. I know Jason in community care is a part of that conversation, and there's a list of services that will occur there. And that will be what we call a level 2 facility. And Central Health will likely be asked to participate in some of the cost of that project. So just letting you know. Austin Colony and Hornsby Bend, we have a couple options. And again, just beginning to have conversations there. But the Travis County Fire Station, there is a potential that land would be available for us to place a modular. We also, there's a new community center that was just completed there, and we will have conversations to see if there are any opportunities at that location. And lastly, mobile services will also be included in the mix as we try to figure out the appropriate response for Austin Colony and Hornsby Bend. I would like to just say that diabetes education is something that will be a part of this project right from the beginning. And our first advisory committee meeting is scheduled May 2nd. Next one is Elroy, and this is the co-located facility with the Travis County Fire Station, approximately 5,000 square feet. Phase 1, we expect to be ready in August, and Phase 2, closer to the end of the year, where we can do more services. UT School of Nursing will operate this. You've heard, they came to a couple of meetings a while back. You heard from Chief Bailey and Dr. Morgan. And so the co-location strategy will be employed here. And we just wanted to really acknowledge Commissioner Gomez, because she really was the one that instructed Chief Bailey to get in touch with us and begin the conversation. So we very much appreciate her help. This is a picture of that facility, and it exists. And what you see in the middle, the build to suit the clinic, is the area that will be expanded. And so with that, Dr. Morgan and the UT School of Nursing folks will be able to fully serve as a medical home for our patients. The CCC already has a contract with the UT School of Nursing, so we're positioned for MAP patients to be seen there. Next is Creekmore, further to the south, strictly in the planning stage. The Travis County, I think when you have success, others like to follow. So I said in our meeting a couple of days ago that the fire department, the fire stations, the emergency services district have really stepped up to the plate to partner with us, and we love it. There's so many benefits. So we'll have conversations there, and we continue to have conversations with Del Valley ISD that have made land available for us to place a modular. More to come. Moving to Northeast Travis County, Colony Park, the Northeast Health Resource Center opened up today or yesterday. I know services are already happening there. We're delighted. This also is where Allen's project, the Mobile Oats and Fish, is located, and the City of Austin master plan work. When this is all completed, it'll be the home of our new Northeast Health and Wellness Center. We also talk about Manor and Pflugerville. And again, the Northeast Health Resource Center, that's a partnership with Austin Independent School District. They offered the portable, and as I said, it's already started. And we have multiple agencies that will be providing services, and at some point, Community Care will relocate their services from Turner Roberts to this location. Community First Village, Mobile Loaves and Fish. There's probably no more exciting project than this one, and it's moving along very nicely. And again, Commissioner Trevilian really stepped up along with Board Manager Shannon Jones with this particular project. And we, again, gained a new partner with ACC just recently. And we have the whole list of partners, Integral Care, Community Care, and others that will be a part of this project. A few photos for you to look at. This is already in design stage, and so, did you pass the first one already? Yeah, okay, so this is just some renderings already for what this may look like. Okay. Colony Park, master plan development. Not much more to say about that. We are at the table with the city. The developer, the recommendation is really expected to go to City Council in October. There are some community meetings that are being held for folks to be able to interview the developer. If that goes well and things move in October, we're still hopeful because master plan development can be a long process, as we know. And we would really love if they'll just carve out our land and let us have it, and we can get ahead of the game. That would be great, and we don't mind doing it. So we'll continue to try to leverage our political resources to help with that. In Manor, Community Care is already providing services in a facility that's owned by Travis County. Again, that's a co-location strategy. The CCC has a contract to help serve Manor with fast med urgent care, and Central Health and Community Care Collaborative are in conversations with Baylor Scott and White to maybe provide services to our patients. I think you may know Baylor Scott and White opened a clinic in Manor. And so, again, if we can leverage other people, then why not? It saves us the expense of capital, and sometimes those partnerships work. And also People's Community Clinic also has a clinic in Manor that's it's a school-based clinic, and it serves their students. Pflugerville. Mike and I and Perla and Yvonne were there last night and talked to the city council. Melissa and I were in Pflugerville last week meeting with officials at the school, and there's great interest in partnering with us to do more in Pflugerville. As you know, there's a health center there already. It's in the picture. That's a county-owned facility. We believe that there's more need in Pflugerville than what we're able to meet at this time. And so we will have conversations to include Travis County, potential expanding its existing site, along with a school-based clinic, probably at the high school, to just get us started. So more to come in Pflugerville. Rosewood Zaragoza, we have a partnership that has come together to repurpose Rosewood, and it will be a resource center, and it will be for the benefit of the community. The partners are listed on this slide that are interested in providing services. After we have the programming done, then Stephen will come back with an estimate on what it takes to renovate the building so that these services can be provided. So you'll hear more about this at a later time. Community engagement. Ted, I think, is doing a great job with his team as far as community engagement and reaching out to folks to let them know what we're doing. The advisory committees are just a part of that, and so those are listed, Northeast, Southeast, Austin Colony, and Pflugerville. We will begin putting a group together. We meet monthly. we get input, we provide information. Those meetings are very, very helpful as we develop strategies. This item is one that's very interesting, and we have multiple agencies that are providing services to the same populations. We're all publicly funded, and so it makes sense that we pause and take a look at our assets. So what we are engaged in very soon is what we call a multi-agency planning initiative to identify joint assets, identify existing service locations, unused or underutilized facilities, opportunities to repurpose buildings, and our co-location strategy, and then find out how we can work together and share the cost. Again, if there's existing real estate on the ground and it's in the areas where we want to be, why don't we leverage it? And I think schools is a great example, but also Travis County and the city have facilities, and so we are going to look at this together and see where it makes sense. Phase 2 of this will take a deeper dive into other organizations. The schools are very important. We will start with the 3 agencies because we're already positioned to do that. But very quickly, we'll include the schools and certain faith-based organizations. Challenges, they are listed here. How do we pay for this work? We are very much engaged in co-location strategies. So this is new to all of us, and we have to sit down and figure out how do we share in the expense. Trying to cover populations and areas like Del Valley, where it's huge, geography is a huge challenge. Rapid population growth, transportation, you've already heard about that. Some of these areas don't even have basic infrastructure, so how do we factor that in? And then provider availability. We may have a will, but then do we have the providers? So all of these are challenges that will be included in our work. Thank you. Questions?
Thank you, Larry. Thank you, JP. Now I'm going to kick the
I'll say after any questions or comments from the board members, I'll do some closing comments.
I'm going to kick this off because stealing from my CEO, Mike Giesland, plagiarize him. It takes time, people time and money. And so it'll take, like I told the reporter today, I spoke to Regina from Univision, it takes baby steps. We're going to get there. Now, with the help of Ted and Ivan, I was prepared enough to speak with her today in Spanish and give her an update over the Overton Elementary School, the Northeast Health Center, and why we're going there. It was one of the first questions out of her mouth is, why here? And I had explained to her that many of our patients or customers live out that way because it's so expensive to live in Austin. They're moving out to that northeastern crescent of Austin. And we need to have resources for them, and we need to be able to give them what they need. A right, not a privilege. And so, you know, we had a long talk with Regina from Univision, and I explained to her that we have to follow where the patients are at. And Larry and his staff are doing an incredible job getting it done. I know we had a speaker earlier not happy with us, but it takes time, it takes people, and it takes money. And like Larry said, you know, this collaboration between the school district and our local fire departments and our Travis County services, wherever we can collaborate, where we can save some money and be able to use that money for health care rather than paying for rent or properties, you know, it's just gonna get us that much further in advance. And I told Regina, you know, the Southeast Health and Wellness Center is Jason's and our jewel. We want another jewel like that in that area. We're going to get it. It's going to take some time, but we're going to get it there. You know, right now we serve patients over at Turner Roberts, but on June 1st we will bring them over to the Northeast Health and Wellness Center, and we're using one of the portables there at the school as a room, as exam rooms. Providers right now, as Larry alluded to, as I was leaving after speaking to Regina, staff was getting there. The mental health staff was getting there to start servicing the patients. Right now, we're gonna use it for enrollment services, MAP, Medicaid, CHIP, what else is it, Larry?
The city will be providing some screenings from the
Yeah.
city.
And we'll get some blood
Care will
pressure,
eventually show.
cholesterol and sugar and blood sugars checked out that way.
Health
And we'll
promotions.
do diabetes education out there as well. That takes time, people, time, and money, as Mr. Giesman has always said. I'm stealing that from you, Mike, and I'm
Go
using
ahead.
it. But we'll get it. You know, I know Mr. Franklin's not, is upset, but, Integral Care is our partner. And Integral Care, I can speak as a board member of Integral Care, we want to be in those schools. We want to help those children. We know that children have health issues. We know that they need us there, and they're going to get it. We're going to get it for them with time. Mr. Wallace is doing an incredible job with doing this, and I'm hoping that Regina from Univision was able to take that message over to her customers, which are the viewers of Univision, so they understand why we're there. That was one of her first questions out of her mouth. Why are you here? Well, we're here because we're following the patients where they need service. But with that, I'll take questions.
Let's start at that end. We're at 30.
Okay, Ms. Jones.
I have a couple of comments, if I may. The first one is, as a board member, I have been very supportive and been active in participating in the Eastern Crescent. I want to commend the work that Larry and his staff have done to do that. So I want to acknowledge they've done some great work. I also want to acknowledge, in terms of the data piece, is that, and I've mentioned this several times, so I brought it today. Here's the most recent mortality map for Travis County. And if you can see, and I know you can't see it that well, but outlined here in the Eastern Crescent, which is this area here, is the darker colors, are where your greatest mortality occurs in this county. It's not coincidental that the same areas that their team was talking about is in these areas. So when the media asks you again, in addition to this is where people live, it's also where people are dying. Unnecessarily so, and in excess death. So I want to emphasize, the data drives where we should be. I also asked if you could get this and sort of somehow or another overlay it with the data that you have presented here. It makes a clear and distinct picture to the community. Not only is the social economic factors that are impacting our county in these areas, the deaths are occurring here too.
We can do that.
That's the first comment. The other thing is, and it goes more to the question that Mr. Franklin had said earlier, he talked about his frustration in not having any services there. But I know in the last 10 years, well, even less than that, there was a couple of district projects, which within the last 5 years, I guess, that were in that area. And for some reason or another, they were not, my understanding, I don't know if they were central health projects or not, but they were not utilized. So I think part of the question with the communities as you go into them is not just setting up and operating, but making sure people know that they're there. I would be interested if Mr. Franklin even knew that there was at the fire station there in Austin Colony, there was a medical center. And so I say all that to say that as you go and expand these strategies, make sure that people know that they're there. And just being there and saying we're here doesn't get it. You've got to have sort of community workers and others in those communities to connect folks with what these places are, what they do there, how they benefit from there. Because we can set them up, but if they don't have that connectivity, they won't go anywhere. So those are two comments I wanted to make.
Thank you, Shannon. Oliver?
Kind of following that direction, just so I'm clear, do we have 3 projects out there or 4 projects?
What area?
In Dale Valley. 'Cause I feel like we heard a lot about this last fall, and then I know y'all have been working behind the scenes, and we haven't had much of a presentation on it, but I know things have been developing, so how many projects are in Dale Valley right now? Or in the works, and what are the timelines for them? Because it would be nice to be able to say, hey, look, we do have we have this one clinic, which I know is, I think, open 2 days a week, which probably, I know Mr. Franklin's, complaints last year is like, well, you don't always get sick on a Monday and Tuesday, and that's valid. That's true. You don't know. You don't know when you're going to get sick. You don't know when your kid's going to get an ear infection. So if we could have a timeline, like how many projects are there? What is the timeline for them to be open? I just couldn't quite tell. It looked like there were 3, but essentially it said land purchase in 2019 for, and I know we reserved money in our budget this year for Del Valley because we didn't IGT funds last year.
Okay, so I can answer your question. On slide number 9,
Got that one here.
okay, Creedmoor is considered Del Valley.
Okay.
Again, we believe we'll be coming to you in July for approvals.
And then when would it open?
Okay, and the reason I didn't put that there, the opening date, is because how quickly can we get delivery of a modular? It's gonna have to be set up, there's site work that has to be done. So, I will have to come back with those projected timelines, but at least the first step would be for you to approve the dollars so that we can move forward. And we'll provide that information as we move forward. Elroy is a second one that is in Del Valley. And again, we have July, and those services will start, we believe, in August.
Okay.
Austin Colony, we'll have our first conversation out there next week. But we do believe that there is a facility that would be available that we could get started pretty quickly. Let's see, I think that's it as far as what we would call Del Valley, outside of what's happening in Travis County.
And then in the Travis County facility, that's just one or two?
Well, they are building another facility right now, and then there'll be a phase 2 that will come 2 years from now.
Okay. So really, there are 4 projects.
If you count them all.
Yeah, okay, that's what I thought. I had it right. I was like, I think there are 4. Okay.
Wait, could one additional comment, if we could get this, our pilot stood up with community care, we could be providing, access to those patients in, Hornsview, Van Austin Colony as early as June, direct transportation to Southeast.
And will those be full-time?
Excuse me?
Will those be full-time, like 40-hour clinics or, 50-hour clinics?
It's transportation.
It's transportation to Southeast Health and Wellness.
Oh.
Southeast office.
Okay.
So,
How many facilities will we have?
Yeah, could you
The number of
Larry, could you recap the physical facilities in Del Valley again that are either there now or will be? Just name them off
Regardless
again.
of who owns them, Travis
Yeah.
County or us, yeah.
Okay,
Infrastructure,
okay.
and just name them.
Okay, we'll start with Travis County.
What do you mean you're starting with Travis County?
I thought you wanted,
A week clinic?
Oh, okay.
A week clinic?
Where is that on slide 9?
That's the one next to the jail, right?
yes.
Is that on slide 9?
Let's do this, members, let's pause just a moment. So if we could go, let's pull up slide 9, and I think, let's pull it up on the screen, and give Mr. Wallace a chance to answer the question, while we're all looking at the same
Yeah,
map,
that would help.
the audience as well.
Yep, that would help.
Okay, so your question was, what's there now?
What's there now and what is planned in Del Valley?
Okay, so what is there now is what we're doing at Travis County. That's the 2-day-a-week operation.
That doesn't appear on this slide, is that correct?
Doesn't, you're right.
Watching it, so that's not on this.
You're right. And all this is on our website too, by the way. But the other would be what the UT School of Nursing is doing. It's not on here because it will transition to the Elroy site. But right now, UT School of Nursing is at Del Valley High School. We did the tour, some of you, a while back, and we had a chance to visit that site. They're not abandoning the school. They're just going to adjust their services so that they can move more resources to Elroy. So if you're asking what is there now, that's it. Okay.
What will be there? What will be there in the future? As far as physical locations in Del Valley?
Go to slide 9.
Okay, well, what will be there is a clinic at Creedmoor.
Okay.
What will be is a clinic at Elroy, that's the partnership with the fire station. What will be is a clinic at Austin Colony. And we probably, community first, really could help serve Hornsby Bend because of proximity. But again, that is not on the ground today, and it probably won't be for another year.
And so Elroy and Austin Colony are in Del Valley proper.
To me, when I look at the map, it's all Del Valley, but we realize that they have communities within Del Valley proper. And so we learned that very quickly, because when people came and said there's nothing in Del Valley, it's like, okay, but through the process of having meetings and learning, and I think the school was very helpful in helping us to figure out like Creedmoor versus Elroy versus Garfield, Colony Park, Hornsby Bend. And so when you take all of this, and that's why I say the challenge is when you have such vast real estate and you're trying to solve everybody's health problem, and there's sparsity, and when you look at your resources and how you use them, it's a challenge, but we're not backing away from it, but I'm just saying.
So I just want to be able to frame a narrative. We've got 2 current facilities there now, with 3 more coming online. Plus Travis County is doing its own separate clinic, full-time, that's coming online.
Yes.
Got it, thank you.
Okay.
Yeah, I thought I was adding it right in my head.
Okay.
Yeah, we heard an interesting comment from a community member the other day. Because so much of the area out here is unincorporated, the ISD has become the de facto city council.
Right.
And to Larry's point, as we discovered, when we first started hearing about Del Valley, we were thinking out here, kind of just north of the airport, old Del Valley. It turned out the ISD crossed the river all the way up here, all the way down to the southern border of the county. So to many people, Del Valley represents almost a quarter of the county.
Yes, that's right.
Thank you.
Sure.
That's super helpful.
And again, Larry and Ted's advisory groups have put together a really comprehensive web page that you can visit to get more in-depth information on this on our website.
Sure, ma'am.
Sure.
And since we're on the topic of Del Valley and looking at Hornsby Bend, Larry had mentioned Stephen Lamp as part of this project in terms of looking at it from a real estate strategy standpoint. There have been a number of parcels of land identified in Hornsby Bend, and that would also serve Austin Colony as well. But as Larry mentioned, there's the challenge of utilities, and so it's not like we're buying parcels of land that have fully developed utilities on them that can support and responsibly and adequately support the level of facilities, whether it's a 1, 2, or a 3 level. So I think some of these, what we call flex solutions, at the staff working level, where, if we can get in there and partner with a fire station, like what we're doing in Elroy, that's not necessarily going to be the end of the strategy for Hornsby Bend or Austin's Colony. But as we have to figure out, and quite frankly, be blunt, this will take additional money beyond a land purchase if you're looking at having to be in the development business, even on a micro level. But going in and developing a piece of property, not unlike what a land developer would do for a master plan neighborhood, although to a much smaller scale, may ultimately be what the long-term solution is. I think a lot of this is a good segue into what you'll hear in May from community care, where it's what level of services are we going to need to be able to bring based on the health conditions for the areas. So there's a couple of factors to consider there as we're moving forward.
Okay, we're at 48 minutes now, folks, so let's try to wrap this up.
Just one
Professor?
clarification, and I want to thank both of you and Ted, and I want to thank every staff member, sorry, allergies, who's working on this, because I know it's a lot of work. I also want to address Shannon's question. At the next Strategic Planning Committee meeting in May, we will be coming back with additional information that we discussed at our last one, and part of it will be how we are going to, as I say, mash up data, overlay data that we have that's demographics with morbidity rates and whatnot. So we'll be coming back to that in May, and I know we'll be doing more in June too. I just had one question of clarification, and again, I know we have people watching this. Back to our favorite slide, slide 9.
We can
around.
just speak from it. We're actually pulling up the Eastern Travis County website.
Okay, so on slide 9, on the right-hand side, there's a column that says 2019 projected updates to Board of Managers. And under that is the City of Austin Colony Park Master Plan, which we've discussed, and we're hoping that we can carve out ours and move faster. And if I can be of any help in that, please call upon me.
Okay.
The next is, I see this Del Valley Phase 2 clinic development and Del Valley land purchase. Does this relate to any of our existing facilities in Del Valley or any that are on the left-hand column that we just discussed?
The Del Valley Phase 2 clinic is Travis County.
That is Travis County?
Yes.
Okay, so I didn't know if that's what I thought, but I didn't know that that was clear to people who may be looking at the slide. And I would advise in the future that we designate that is in fact Travis County. It's out there and it's a facility that will be wonderful, but it is Travis County. Okay, thank you.
I just want to say thank you to both of you. Excellent work, and
Yes.
I sort of echo many of the comments that the other board members have said. Keep pushing forward.
Thank you.
Thank you very much to all of y'all, the whole team. I'm going to start backwards. It's just a few things. Of course, in my area, Rosewood Zaragoza was of great importance, and it was my understanding, and in me talking to many of the people, the neighborhood association and the community members there, they wanted and expected that clinic to open, not to be set aside as a resource center. You could have some space for the resource center, but they want a clinic back in their neighborhood. That's our neighborhood. And so I don't know if you had any specific meetings with any of the community members, and if so, the next one I want to be at. And there's a lot of interest in seeing that resource, that Rosewood Zaragoza redeveloped, but again, with the community's understanding that it was going to be a clinic. That was their expectation. And so, is that no longer a viable option?
I would like for you to wait until next month when Jason presents his presentation. Community Care's strategy is included within what's happening at Rosewood Zaragoza, and he can provide information on utilization, the data that they've tracked, other existing resources within the community that are available that are untapped. So it wasn't just a decision that was made without a lot of consideration. And in addition, the renovation cost was going to exceed $4 million to really make it a clinic again, the way that it was being requested. So when you look at that capital investment, and we don't own the building, so some decisions were made, but I think if you will allow Jason to come back next week, and the most important part of all of that is nobody's losing services. People still have access to care in their community, and so I will defer to him at our next meeting if you will allow.
I appreciate that, but this is an issue that was near and dear to my heart, and before I came onto this board, because one of the things that we fought was and with some concern, is the plans that were originally made to do the Sandra Joy at Houston Tillotson without looking at what we were going to do at Rosewood Zaragoza. And we in the community were very concerned about that. So that concern is still there, and even going 1.5 miles down the road to Sandra Joy was a consideration. So because Go Valley and East, that Rosewood Zaragoza area still has a viable population, whereas that meets our needs. It's our targeted population, whereas many who were living in the Houston Tillotson area did not. That was already totally gentrified. So I would like, if these are not, is this plan set in stone is what I'm asking.
It has to come before this board for approval.
Okay, but are the plans, the meetings, for this particular thing, are they being set in stone? Not only for what's going on at Rosewood Zaragoza, but I see the need for continuation of the planning for Colony Park, for Austin Colony, for Del Valley, all those other areas. The Rosewood Zaragoza, because it's within the city of Austin, was another concern. And so is there opportunity to have a discussion maybe with the people who are on this team that are developing this? Because I noticed that you have some advisory committees for the 4 groups, and I didn't know whether or not those advisory committees included any community members. And if so, then I have a question with respect to what's going on for the Del Valley group, that even though Richard was a member of the board of the school board there in Del Valley, they didn't seem to know that there was something going on in that area. So at some point, Ted, I'd like to talk to you or Larry about specifically who is the advisory committee in these areas. And because when you talked about your partners, I saw a lot of agencies, almost all agencies are governments, and I didn't see neighborhood groups in there. And that's, to me, you have to have the neighborhood groups involved in that planning because they live there. And a lot of times, people who are in governmental agencies, aside from the school board, don't live in the area and don't necessarily know that area as well as the residents would. So that's another, because that's very important to me with community engagement and community involvement in the decision-making process. So with respect to that, I'd like to have, I'd like to be involved at least, or at least let me know.
Can we get Jason to talk to you, Cynthia, and that way we
Yeah.
can get you on that
Yeah,
board?
and we have talked before, but more specifically, I'll make sure
We're
it's
at
tied to this.
55 minutes already.
Yeah, no, I agree, I understand. It's just that we just got to my side of the table.
So I'm sorry.
Can
And
I,
maybe,
can I address just the advisory committee question? Half the folks on the advisory committees are people that live in the community. They represent the neighborhood associations, and those names are on the website. Each committee is listed. So we were very careful to make sure that the neighborhoods are represented.
Because I hadn't looked at the website, just make sure they have the next meeting date and the location.
so-
I appreciate it. And one more thing, and if you could, like Sherry asked, I thought that's what she asked, or Julie, to the superimposed maps with the existing locations and the new or future locations and the date, maybe that would be really good for the public to see.
I just want to point out for everyone and for the public, you see on the screen behind us, this is directly from our Central Health website. And I want to thank Larry and JP and Ted and others, Ted who's been working on this. You can go straight to the website and see all of this by our planning areas.
And just one last question. As we're moving people to the Southeast Hub, I just want to make sure that the analysis for capacity has been addressed by community care, Jason. And so maybe in our conversation, we can talk about that to make sure that these facilities that we're going to be moving people to, transporting them to, have the capacity to be able to address them.
Thank you, Ms. Valdez. Larry, JP, thank you. Jason, thank you. Hopefully we'll hear from you next month, and we'll bring back with more fantastic information as Larry and JP already have. Thank you.
Thank you.
All right.
Thank you.
Agenda items 2 is receive and discuss a briefing regarding the Birch et al. Versus Travis County Healthcare District doing business as Central Health and Mike Giesland. Cause number D-1-GN-17-005824 in the 345th District Court of Travis County. The time is looks like 6:49. I announce that the board is convening an executive session to discuss agenda item 2 under section 551.071 of the Travis Government Code, consultation with attorney. Texas Government Code, sorry. Okay, it is 6:58, and we're coming out of executive session. No action, nothing was, no action was taken, so move on to agenda item number 3. Receive and discuss and take appropriate action on information regarding Central Health Board of Managers online message board. Mr. Giesland and Mike McKinnon will discuss that.
Members, thank you. Before I recognize Mike to walk us through how the message board will work, there is a request tonight, and that is to allow the CEO to designate staff to post on the Board of Managers message board. And this is for a couple of reasons. One, I want to make sure that the right staff are empowered to respond to questions that are posed by the board member. I think that will allow for more timely response, and it won't create a bottleneck in my office to get those responses out. But two, we want to make sure that we can empower the panel staff necessary through the CEO's office. Otherwise, we'll have to be bringing individual names to this board each time we need to add somebody. So I think it's just better from a management standpoint to let that be managed out of the CEO's office. So that's the request that we're asking for and the rationale behind it. Lastly, this is a tool. This is a tool that is open and transparent, and it allows, it's specifically allowed for in Texas law. This is not something that you have to create and go get a legal opinion on. This is actually contemplated within the body of law. It is a form of public dialogue, so be mindful of what you post and treat it as if you were in a regular meeting. We'll try this out, and there may be different. It's already live right now, but there may be different sets of instructions as time goes on. But I think it's important. Tool. In the time being, we would appreciate any feedback that you all have throughout this process. Mike.
Good evening, Board. Mike McKinnon, I'm the Communications Solutions and Innovation Manager for Central Health. And I'm just going to walk you very briefly through this new tool. If you've ever used a message board of any kind before, this will be absolutely no surprise to you, but we just wanted to make sure you're aware of how it was set up. So when you go to centralhealth.net and click on Meetings, just below the Meetings portal, which is about halfway down the page, you will see a blue box that says Board of Managers Message Board with a bright orange button that says Visit the Message Board. So you click that, and that will actually bring up the board. And it's set up with very broad topics at the moment. As you can see, it's mostly meetings based. There are a couple of other topic areas such as the 2019 budget and reports. We can add more topics upon request, of course. So in order to use the message board, anyone can read these topics. Any member of the public can click and read any content within them. But in order to create or post content, you do need a verified login. And Emily, we went ahead and set this up earlier, but each of you has a username and password. So if Emily, you scroll up to the very top just so they can see, I guess it locks it out. There is a button that says log in. Sorry, we've already logged in, but it takes that away. But it's very intuitive. So when you click into one of the topic areas, for example, the Board of Managers meetings, I believe the way it's set up right now is each meeting will have a post, and within that we'll be able to put the packet and agenda in there. You'll be able to ask questions, and we'll be able to provide feedback. The post that has a little pin next to it is just a sticky post. That means it's always going to be up at the top. We can do that on any forum that we like, just to make sure that relevant and important information is always at the very top. Right, so to create a new topic, of course, you create new topic, click the new topic button, and there you have it. You create your subject line. You will be able to upload files. At the moment, although it says you can upload more, it's limited to PDFs. That's a glitch we're trying to work out, and I believe images like JPEGs. So you can upload and attach documents as well, and then of course, whatever actual written content you wish to submit as well. And then of course, staff members or other board members will be able to respond. So very straightforward. It's nothing that hasn't been around for many years. There is the possibility to add some more features as, you know, requests come along or as the technology advances. But we intentionally set this up to be very simple, very straightforward, very, very basic, mostly for transparency reasons, but also just for ease of use. And if Emily, you could back up one, so you can see there's sort of the breadcrumbs there where it says forum and then the little arrow up at the top. You can actually back up. Oh, sorry. Yeah, I think we've been having trouble with this computer loading, web pages. Let's see if it comes back. Yeah, it was doing this yesterday. I think we need to burn this computer. Okay, so it's broken again. I was going to show you the reports form. Actually, I'm putting the communications reports into a topic there. So, if you would like to have a printed report, we're just thinking to save trees. I can load the PDF in there, and at your leisure, you can go in and download those reports. And I think we could do that with any report that we generate, just as backup to the board packet or just supplemental information. So if there are any questions, I'm happy to ask them. Again, everyone should have a login. I believe that information's already been collected. If there are any issues, any problems, please let me know. I believe that the staff you see here will mainly be responsible for moderating the forum. And again, it is open to the public, so people can peruse the content, but not necessarily comment on it. And then one other thing, it is linked here on the meetings page, but I've also put a link in the very, very bottom of the footer, which is on every single page. So if you do need to jump to it, if you keep scrolling all the way down. So you see at the bottom where it says library and message board. So that content is available from any page on the website. So that's the message board. Any questions, I'm happy to answer them.
Yeah, I'm one of those, I thought we were going to be getting like hands-on training. So I went to the message board. I tried to do it earlier this week, and I didn't know what my password was. I didn't know any of that information. And to my knowledge, I have not yet received it. So that I could actually test this out and ask you any questions, I guess we can do it later?
Sure, absolutely.
Okay, or if we need a subsequent training, we can just
feel
come
free.
in and
I'm here to help.
go through it. So with respect to subject matter, will we be able to discuss agenda items here?
That's a legal question, I think.
So
I'm
you can discuss agenda items, but you can't do any sort of polling or
it would be
discussing how you're planning to
like
vote.
like a general, if we know we're going to get something, let's say on this particular item, would we be able to, I would be able to say, okay, something about the item, or if it was going to be with respect to the budget, I would be able to ask about something about the budget. Okay.
And I think that if it would be helpful for the board, I think legal could put together some guidelines to help.
Yes,
Okay,
yes,
we'll
so
do
that we will know what our limitations are.
Absolutely.
So my understanding is now that we've had this presentation, Emily, you're going to be sending out to us our login and password. Great. And I think the guidelines would be helpful. Some of us, I've used the city council one before, and it's what you were saying, you can't like vote or poll, but you could comment on an agenda item. I have a question on this, need more information. Thank you.
Any other questions? Yeah?
I was just concerned in terms of those who are outside of the public, outside of our community who wants to have access to the communication we're having, who are not as comfortable with using seniors, for instance, and young folks as well. How do they have access to this information? Are they able, are we limiting them in terms of our discussion by utilizing this?
So we have to be careful about what we use. So if it is involving a decision that has a big impact on the community, this is not It's certainly a legal and usable tool, but this is not the sort of thing that we would use for that very reason, because there are, you know, if you think about the digital divide and also levels of accessibility and access, even then, you use this for a discussion. The decisions that ultimately need to be made and discussed still come back around to meeting forum. And so the access is probably, I hate to say the word access limitations, because I think that the access challenges that individuals have with an online forum are going to be equal and commensurate with what they would have with this forum right here, in terms of actually getting here. Now, and I think that's why it requires a very judicious approach to what we use it for in terms of the topics.
I agree with everything you said, and I've worked with the city, so I'm familiar with it. One of the things I constantly heard when I was with the city is that citizens say, well, you all have already discussed this item, and so we're here basically to vet what you've discussed, and I haven't even been part of that dialogue. So I do think that the parameters under which we use this need to be clear. We don't find ourselves in a situation and say, well, we've reached consensus, not in a vote concept, but even the discussion concept, and then come here and then talk about it and then move action on it. That was my concern.
Yes, sir. Duly noted.
I concur. That's what I was saying. I would see it be more used for asking questions than information provided in the way of reports or whatnot.
And Emily's available for us to talk with if we have questions.
As well as Nicole, Holly, let's see, we have somebody here, we have lots of people.
Down here at the bottom, it says that there are already 11 topics, there have been 11 posts, there are 353 views, 25 users, and 2 online something. I'm assuming that's a comment. But we hadn't been able to see it. How did that happen?
It's all staff.
Oh, staff's testing it.
They've been beta testing it.
Yeah, we've been testing it. We've been uploading materials just to try it out. And some stuff will, I mean, this is, you know, stuff that is permanent. It's content that's permanent. It's various reports and previous agendas. And and you can actually see who's been posting on that far right column and when it was posted.
So then a follow-up then to what Shannon asked, if there is a public, someone in the public that made a post, they will be able to use this to make a post so that we maybe, yes or no, so that we can, they can't post at all. It's just us. Because I know in some of the others, some people can't actually post from the public.
This is an online forum for the board to have a dialogue with each other.
No, I understand that, but.
Public can view it just as they can sit in those chairs there and view this meeting, but it's not for the public to, it's not for a community conversation like what we have out in the community, for example.
Will there be some kind of a proviso somewhere, notice that says to the public, if you have a question, call Central Health? You know, maybe on this page, just in case, you know, I just want to make sure everybody has a clear understanding.
It's not unlike other areas of the website.
Yeah, just so they have a clear understanding if they should happen to get to this. By the way, you know, you cannot post, but you can call Central Health and ask for further information.
I think we can definitely come up with a set of very basic policies that we could have in a.
We were talking about those guidelines, right?
Post.
Yes. Thank you very much.
Absolutely.
Any more questions? Seeing none, I will entertain a motion.
Second.
I move that the board empower the president and CEO of Central Health to authorize individual staff members to use the Central Health Board of Managers online message board.
I second it.
We have a motion by Professor Greenberg and seconded by Dr. Bell. All in favor say aye.
Aye.
All against say no. Abstaining? Okay. The item passes.
Thank you.
Thank you, members. Item 4, receive and discuss reports from board committees, Budget and Finance Committee, the Strategic Planning Committee, and Ad Hoc Women's Health Committee, Downtown Health Campus Committee. This shouldn't take but 10 minutes.
Mine will take a lot less than that. Since we haven't approved the consent agenda, you'll see many of the items that we discussed in the Budget and Finance Committee We went over the financials for both CCC and Central Health, and big accomplishment, we discussed and brought a recommendation forward with regard to the homestead exemption.
Thank you, Dr. Bell.
We had big attendance. Most of the board was there. We talked about the Germain report and the community meetings. We also had a very good initial level set discussion of social determinants, which, as we've mentioned, will be coming back with more data and some follow-up that board members and others have asked for. And we had an update on the very successful education initiative.
Thank you. Is anybody there for the Women's Ad Hoc Committee? Akins? Manager Daniel's not here as well. I was there for the downtown campus, and no action was taken. First time. So no action is necessary on this agenda item. All right, agenda item 5, receive and discuss a report from the President and CEO on central health operations and current activities, including A, the current strategic plan and related measures or dashboards. B, an assessment of systems and processes and prioritization of activities and initiations. And C, personnel matters. Mr. Giesman?
Thank you. So members, mine will be brief. In your board packet is a memo from Jonathan Morgan to the Central Health Board of Managers and myself. And we asked Jonathan to put this together because in the March meeting, we had an update from Dr. Hernandez on activities of the Community Care Collaborative, but because of the time and the hour, he had to truncate his report because of the late hour. And so there was a lot that could and quite frankly should have been discussed around specialty care work, which directly affects two key strategies for us. One, our patient wait times and experience, actually three, patient wait times experience, but also the adequacy of our network activities. And so this memo provides some mid-year highlights as well as some continued activity for fiscal year 18 and upcoming activity for fiscal year 19. I just wanted to draw your attention to this memo. I think if there's deeper questions, I'm happy to arrange additional meetings with CCC staff. But nonetheless, I think this is important to understand the level of work going into bringing more specialty care online. And also, I think it's responsive to some of the questions that were raised at the Budget and Finance Committee meeting and looking at some of the reports on specialty care expenditures.
Thank you very much. I just wanted to ask a question with respect to the specialty wait times. Are we going to ever know whether or not those that are still on the list for a period of time, how long they have been on? Like, will there be something that's 30 days, 60 days, 90 days, a year, and they're still on?
Yes, and that's alluded to within this memo further down. I don't have it right in front of me, but the short answer is yes, and that's one of the reasons why I'm moving to fibroblast and having better data tracking is so that we can actually see in very simple form, just to your point, what the baseline is and then where we are relative to that baseline, 30, 60, 90 days. I'm not sure about how they're going to break down the days. I want to be able to answer those simple questions.
Yeah, I would hope that it would be at least that way. That's the way collectors do it. But as far as I'm concerned, 30 days, 60 days, 90 days, 100, whatever. And then once it gets into beyond 6 months, then I would hope that they would go from 6 months to a year wait time. And if we don't have anybody from the 6 months to a year, then that's a huge accomplishment. Because the last time I looked, we still had some people who were on the waiting list for at least that 6 months to a year.
Right.
And so once we get that particular population eliminated, then I think that's a big success for us and a way for us to be able to gauge that whatever it is that they're doing is working.
Right.
So thank you very much for that.
Any other questions? All right. No action is
And that would be by practice. I'm sorry, by diagnosis. Like ophthalmology, neurology.
The line of service.
Line of service, yes. Okay, thank you.
Certainly. No action is necessary on this agenda item. All right, let's go to the consent agenda items. C1, approve minutes for the following meeting of the Central Health Board of Managers, March 28th, 2018, and April 14th, 2018. C2, receive a report of the March 2018 financial statements for Central Health as presented to the Budget and Finance Committee. C3, receive a report of the February 2018 and March 2018 financial statements for the Community Care Collaborative as presented to the Budget and Finance Committee. C4, receive the March 2018 investment report and ratify Central Health investments for 2018. And C5, approve an increase to the disabled and 65 and older homestead exemptions for Central Health from $80,000 to $85,500 as recommended by the Budget and Finance Committee. These are all consent agenda items. This has come from the Budget and Finance Committees, and I just need to entertain a motion.
So moved.
Sorry?
So moved.
I had an item I would like to pull.
Oh, pull that.
Okay. Which one would you like to pull?
Item 5, C5.
Okay. All right.
May I make a motion that we approve item number C1 through C4 on the consent agenda?
Okay.
Second.
Okay. All in favor, say aye.
Aye.
All against, say no. Okay. All right, so C5, Mr. Jones has requested that we pull consent item C5. Let me read that again. Approve an increase to the disabled and 65 and over homestead exemption for Central Health from $80,000 to $85,500 as recommended by the Budget and Finance Committee. Is there any discussion?
Yeah, I pulled this because as a citizen of Travis County over age 65 who would benefit from this, I feel that I should declare that and ask that the vote be held separately so that I would be voting on that.
Understood. Understood. And anything else? Any other discussion?
There was only one thing on this agenda item that I had asked for last meeting, and that was if we could have some kind of semblance of broken down by precincts 1, 2, 3, and 4, or geographic. I think that would have been the easiest, but that's okay. But I eventually would like to know this with respect, especially since we're talking about a.
So do we, my apologies, but just because of the time frame and other work volumes of getting from Budget and Finance to this meeting,
I'm so sorry.
we weren't able to pull together that type of geographic information system to map that out for you. That is something that, Jeff's in the room.
Okay.
But, that is something that, I mean, we still know that we owe that to the board, and even though with this vote, we're still gonna bring that information.
I appreciate that. Thank you very much,
As
sir.
straight up as a bandwidth issue.
So should I go ahead and make a motion to approve item C5?
Hold on, time. I'm just talking to council. I did take a motion, I did take a vote on
Yeah.
C1.
Yes.
Yeah. Okay.
There was
All
a
right.
vote.
And
Yes.
that was approved, Yes.
Yes.
All right. Sorry, council.
Somebody needs to move
So
C5.
I move item C5 with the proviso that it be a roll call vote.
Second.
So then we're gonna do it by hand count, is that what we're talking about?
Roll call, she said.
Roll call.
Okay, all right.
So who's gonna call?
Emily, can you just read
Call the
down
roll,
names
Emily.
and-
Chairperson Guadalupe Zamora,
Aye.
Vice Chairperson Sherry Greenberg,
Aye.
Treasurer Charles Bell,
Aye.
Manager Shannon Jones,
Abstain.
Manager Julie Oliver,
Aye.
Manager Cynthia Valadez.
Aye.
We have 5 votes in favor, so, and with one abstention from Mr. Jones. Motion passes. Thank you, board. All right, one last agenda item, number 9. Confirm the next regular board meeting date, time, and location. The next Central Health Board of Managers meeting is on Wednesday, May 23rd, 2018, at 5:30 p.m. Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. And with that, I'll entertain a motion to
Move adjournment.
Second. All in favor, say aye.
Aye.
Against, no. It passes.
Right.
Thank you, guys. Thank you, board.
Thank you.
That was incredible.
Yeah.